Hey everyone, and welcome to my first ever video here on YouTube. I'm Sheila G the PAC, and in this video I'm going to be talking all things related to acne formation and treatment. For more dermatology content, please like, comment, and subscribe to my channel. So acne vulgaris, or common acne, is a chronic inflammatory condition of the pilosebaceous unit, which is where the oil gland or sebaceous gland and the hair follicle connect. Acne affects about 85% of adolescents, and although it is most common among adolescents, it may also affect adults too, especially post-adolescent females. Acne tends to be worse in areas of the body where the oil glands have a higher concentration, so the face, chest, back, and shoulders. So we don't have a very strict rating system as far as how we exactly classify the severity of acne, but in general it is as follows. Mild acne consists of open comedones, known as blackheads, and closed comedones, known as whiteheads, and these are non-inflammatory lesions. Open comedones, or blackheads, have dead skin cells or keratin exposed to oxygen, so it starts to turn black in color. It's called oxidation. It's kind of like when you leave an apple out for too long and it starts to turn brown. For closed comedones, the keratin, the dead skin cells, are trapped underneath the skin, so they remain white in color. Mild acne may also consist of a few pustules, which contain pus, and papules, which are basically small inflamed bumps on the skin. For those with moderate acne, we start to see a few more papules and pustules, and now even nodules on the skin. Nodules are larger inflamed bumps that result from follicular rupture, but we'll get back into that shortly. Severe acne presents in various clinical forms. Before simplicity, we start to see many papules, many pustules, and even more nodules and cysts with likely scarring on the skin. Nodules may even start to form tracts underneath the skin that connect with each other, known as sinuses, in certain severe clinical forms. Now let's get into the pathogenesis of acne, which is how the disease process develops. The four key factors involved in acne include sebum production, follicular keratinization, the presence of Cutibacterium acnes, and inflammation. So let's get scientific and break all of this down. Sebum production, which is oil production, is increased when circulating hormones, known as androgen hormones, reach and signal the sebaceous gland to produce more oil. This also leads to increased shedding of those sebaceous gland cells, known as sebocytes, into that sebaceous duct. That is known as follicular keratinization. When those cells continue to shed and they stick together, they ultimately form a clog within that follicular canal, which ultimately dilates the pore. That's when we start to see the presence of blackheads and whiteheads on the skin. Gram-positive anaerobic bacteria known as Cutibacterium acnes, or C. acnes, thrives in environments where oxygen is not present. So when that pilosebaceous unit is closed off to oxygen, because of that plug formation, it allows for an environment where bacteria can thrive. So stepping back for just 1 second, because this is important. The sebum that is produced is made up of lipids and wax esters. Those are the properties that protect the skin and the hair follicle. Why am I telling you this? Well, the bacteria that's involved in acne, again, Cutibacterium acnes, actually turns those lipids into fatty acids. And when that happens, it attracts pro-inflammatory cytokines or mediators into the skin to allow for a big inflammatory response. In addition to this, because that follicular wall is expanding because of that plug formation, ultimately it's going to end up rupturing, and that's when we see an even bigger inflammatory response. So that leads to the presence of nodules and big cysts on the skin that are quite painful. When that process becomes repetitive with inflammation and bacteria, we start to see scarring on the skin and post-inflammatory pigmentation. Now that we understand acne and how it forms microscopically, let's focus on the impact of hormones, as all acne is hormonal to some degree. As previously mentioned, androgen hormones specifically play the biggest role as far as acne formation. But how exactly does that happen? Androgen hormones, including testosterone, are produced by either the testicles in males or the ovaries in females. The adrenal glands also produce various androgen hormones. These hormones are responsible for the changes that we see involved in puberty and adult maturation. Androgens act directly on the sebaceous gland via androgen receptors and stimulates them to produce more oil. That is what primarily contributes to acne in certain individuals. For clarification, for those with acne, it does not necessarily mean that your hormones are off balance. It more often means that the hormone receptors on the sebaceous gland are a little too sensitive to those hormones. And there are some genetic factors involved in that as well. An important exception would be female patients suffering from PCOS or polycystic ovarian syndrome, where testosterone levels are too high, and that contributes to acne, facial hair growth, insulin resistance, and infertility. But I will be doing a separate in-depth video on PCOS specifically in the future. It is important to note that estrogen has been shown to actually potentially decrease frequency of breakouts because estrogen decreases the amount of androgen hormones produced. That is why for females, going on birth control pills that contain estrogen may or may not actually decrease the frequency of acne breakouts depending on the medication that is given. Another hormone that contributes to the severity of acne in some cases is insulin-like growth factor, and it is less frequently talked about. Insulin-like growth factor is a hormone that is produced in the liver, and it responds to growth hormone, and it basically regulates the physiological functions of the tissues throughout the body and maturation. Insulin-like growth factor also spikes after consuming foods that have a high glycemic load, and that is why acne and diet may potentially go hand in hand in certain cases, or at least the severity of it. So now that we've gone over the primary causes of acne, let's touch on a few things that may contribute to acne severity. So diet may play a role, and I already touched on that with the insulin-like growth factor. Another thing would be genetics. So a lot of my patients that have more moderate to severe acne tell me that they have or have had somebody in the family also suffer from acne. We don't understand the exact link, but it is something we see all the time. Another thing would be cleansing habits, picking at the skin, friction, rubbing, product usage. There's a lot of things that may contribute to acne as well, so it's very important to discuss all of this with the patient. Moving on to acne treatments. In order to treat acne effectively, healthcare providers must be skilled in recognizing the type of acne as well as the severity, and a detailed history is very important in order to pinpoint individual needs. It's really important to understand that acne is stubborn and takes at least 6 to 8 weeks of treatment in order to see a big difference. So patience and consistency is key. To organize the available treatments more easily, let's go back to the 4 main pathological factors involved in acne and discuss the treatments that target them specifically. So starting with increased sebum production. Topical retinoids help to regulate and reduce oil production in the skin. Prescription retinoids include tretinoin, adapalene 0.3%, the 0.1 is actually over the counter now, tazarotene, and trifarotene. These medications are applied to the affected areas of the skin at nighttime after cleansing. It is important to note that these medications may cause some irritation, some dryness, and peeling on the skin over the first few weeks. So depending on acne severity, it might be better to start at a lower strength retinoid or to apply them less frequently, working up to nightly as tolerated. Other treatments that target increased sebum production include more hormonal treatments such as oral spironolactone or oral birth control pills. Oral spironolactone was actually originally a blood pressure medication known as a potassium-sparing diuretic, but we found that it actually has anti-androgen effects where it blocks those androgen receptors in the skin from responding to those androgen hormones. And so, especially for females that have more frequent breakouts around their menstrual cycle, it's actually a pretty good option. Spironolactone is usually only prescribed to female patients suffering from acne because of the anti-androgen effects in males and might actually lead to breast enlargement known as gynecomastia or other sexual side effects. Another hormonal treatment, though, has recently become available known as Winlevi or clascoterone. This is actually a topical anti-androgen medication that acts very similarly to spironolactone by blocking those androgen receptors from responding to those androgen hormones. But you bypass a lot of those side effects that we see in spironolactone because this is a topical medication. Side effects that might be seen with Winlevi could include irritation or even allergic contact dermatitis, but that's actually pretty rare. Winlevi is applied to the affected areas of acne about twice a day for the most optimal effects. Oral corticosteroids might also limit sebum production at low doses, although these are not often used unless temporarily indicated for certain severe clinical forms of acne. Moving on to treatments for follicular keratinization. These also include topical retinoids because they increase cell turnover, which basically breaks up those compacted cells and keratin within the pore. So it's a really good option for those that also have more blackheads and whiteheads on the skin. As a side note, retinoids also build up collagen in the skin, so it helps significantly with acne scarring and even hyperpigmentation. Other ingredients that target excess keratinization in the skin include salicylic acid, which is a beta-hydroxy acid, glycolic acid, which is an alpha-hydroxy acid, and lactic acid, which is a humectant. Now, lactic acid is not as commonly used for acne, but it's less irritating. Treatments that target Cutibacterium acnes on the skin include topical and oral antibiotics. Topical antibiotics include clindamycin, benzoyl peroxide, minocycline, erythromycin, and dapsone. Oral antibiotics include tetracyclines such as doxycycline or minocycline. Doxycycline tends to be the oral antibiotic of choice due to its favorable side effect profile in comparison to oral minocycline and its longer half-life. Please note that these medications are also anti-inflammatory, which is why tetracyclines typically are preferred. Other antibiotics that may target C. acnes on the skin include Bactrim, cephalexin, and amoxicillin. And then finally, inflammation. A lot of the aforementioned treatments may target inflammation, but most notably, again, topical retinoids and oral antibiotics. Other treatments that might be anti-inflammatory include topical dapsone in particular, as well as azelaic acid. Azelaic acid is an antioxidant which neutralizes free radicals in the skin in order to reduce inflammation. So it's a really good option for those with acne, rosacea, or those who are pregnant that are seeking acne treatment. Another thing that can be done for more inflamed, larger nodules on the skin include intralesional steroid injections. That's where a very small concentration of steroids are actually injected directly into that lesion and reduces the inflammation within about 24 to 48 hours. But healthcare providers must be very careful not to inject high concentrations, as that may lead to thinning or atrophy of the skin. But technically it is an option. A lot of these treatments may be prescribed separately or in combined formulations depending on individual needs. Other active ingredients such as benzoyl peroxide or salicylic acid may be implemented into the skincare regimen in the form of a cleanser or even a moisturizer. It is important to consult your dermatologist for proper individualized treatment. Now, by far the most effective medication for acne is isotretinoin, better known as Accutane. So isotretinoin basically targets all 4 pathological factors involved in acne by shutting down the sebaceous gland completely. However, this medication is highly regulated as it is considered category X or severely teratogenic, and that means that it may cause severe birth defects in pregnant patients. So pregnancy prevention is the biggest thing with isotretinoin. So that is a whole other conversation for another video, and I will be making that video very shortly on my channel, basically going over all the details as far as Accutane, the process, and even iPledge, so stay tuned for that. So there you have it, a complete overview of acne formation and its treatments. I'll be making many other videos talking about different acne products, different skincare routines, and general recommendations. If you found this video helpful, please like, comment, and subscribe to my channel for more dermatology content. I'm Sheila G, the PAC, and I'll see you next time.